Influenza pandemics, whether moderate or severe, are remarkable events because of the almost universal susceptibility of the world's population to infection. We are all in this together, and we will all get through this together.
In the spring of 2009, public health officials were alerted to an unusual outbreak of influenza.
Tuesday we reported that we had confirmed 2 cases of influenza that were swine flu in children in California.
On April 23, 2009, the CDC announced that this strain of influenza had not been seen before in the U.S. or anywhere in the world. It was a new strain of flu.
Today, Mexico's Minister of Health confirmed that they have cases of swine influenza in people, and that they believe some of the people who were infected died from swine influenza.
The world was confronted with a new flu virus to which it appeared no one had immunity. The potential existed for a severe pandemic. The public health community responded.
Over the last week, my administration has taken several precautions to address the challenge posed by the 2009 H1N1 flu virus.
Those precautions included disseminating public health recommendations through a variety of media.
WHO has officially declared us to be in a pandemic.
In July of 2009, scientists and public health experts from across the country came together in a pan-flu summit at NIH to discuss the most effective ways to minimize the impact of the H1N1 flu.
If this H1N1 pandemic influenza virus had appeared in November or the beginning of December, we would have incorporated it into one of the components of the seasonal flu, and no one would be asking the question, is this a brand new vaccine for a brand new virus? Because the viruses change each year, and we change the vaccines each year.
Crazy to think this time last year you were really sick.
When H1N1 first surfaced last spring, Cretin-Derham Hall senior Shannon Stinchfield was among the first to get it.
3 days of just horrible body aches and fever.
She didn't know what it would bring, and neither did her mother, Patsy Stinchfield, who was also director of infectious disease at children's hospitals and clinics. So 1 year after the pandemic began,
what have experts at children's hospitals and clinics and across the country learned about H1N1? More children of color, more obese, more kids with asthma, and more young children being admitted than adults or any other types of chronic conditions.
And Stinchfield does not think H1N1 was blown out of proportion.
And we really didn't have a choice but to be very prepared.
In labs around the world, scientists are racing to understand the new coronavirus. They want to know where it came from and how to stop it. And to get the answers they need, they've turned to bats.
75% of emerging infectious disease came from animal. Bats can carry the viruses without symptoms. They look healthy, but bats can transmit virus to other animals or to humans.
Dr. Supaporn has been studying these viruses for years at Thailand's Chulalongkorn University. The coronavirus spreading now shares almost a 100% DNA match with another one found in bats, and she hopes that studying wildlife can help us prevent and control outbreaks in humans. Dr. Supaporn helped decode the genome for the first confirmed case of the new virus outside China.